Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here. And here at Gold, we are in the preparation of our first tongue tie conference. We had symposiums before in the past, but now is our first full conference here of 2024. And with me here is our keynote speaker, Melissa Cole. So good to have you here, Melissa.
Thank you for that warm welcome. I am equally excited about this event.
I can't wait for it. It's, tongue tie is such a wonderful event. We had so many requests for putting a full conference together. We had our symposiums in the past, and it's just wonderful that you are opening up our conference this year. And the title of your presentation is A Mindful Approach to Infant Tongue Tie Care. I'm so excited about the title. But first, before we go into that, tell us a little bit about yourself. You're an IBCLC. You have worked in the field for a very long time. So just give us a brief background here, Melissa.
Absolutely. Well, my professional background has had different twists and turns, but for the last 20 years, I've been providing clinical lactation and infant feeding care. I'm also a clinical herbalist in private practice, so I have a few hats on. But I've also been honored and privileged to participate in various research projects and do a lot of active teaching. And I think if there's any way to really try to learn material self is to try to teach it, right? Teaching is humbling and is a wonderful way to learn material. So I'm really excited to dive into this conference with everyone else.
Oh, wonderful. Thank you for being here for that. Now let's dive into your topic, which is such a beautiful topic to open up the conference. It is titled A Mindful Approach to Infant Tongue Tie Care. So my first question to you here is, let's talk a little bit about the mindful approach, just to, set the scene here for our viewers. What does a mindful approach mean to you, Melissa?
That's a great question. We know that families navigating tongue tie are often going through an emotional, physical roller coaster ride of experiences. Mindfulness as a word, I think it often can be thrown around a bit and almost cliche in some circles. But to me, it is really vital when we're thinking about how do we as clinicians remain conscientious and curious about really diving into the emerging evidence and figuring out what does best practice look like? How do we do our due diligence to thoroughly assess, to help families make informed decisions around care regarding their child? And so it does take an element of mindfulness to be kind of constantly reevaluating and critically thinking about our own practice, so we don't get into a clinical rut, but that we continue to level up our care.
That sounds fantastic. Yeah, you mentioned something clinical rut. I love how you describe that there.
Yeah,
But it is so true, right? Especially when we're busy. There are so many families to serve and to see, and and it feels like it is easy without because we're all coming from the same place of passion, and we want to help the families, and we want to be there for them and do the best for their baby. But sometimes because of time is, we're short of time, we have so much to do, so much to see. So there is, of course, the danger of, ending up in a rut, even if we don't want to. So it is nice to kind of remind ourselves to really look at things with a fresh approach and be kind of always open to learning, right?
Exactly, especially around this topic. How can we continue to do better, provide better care? And that does take some reflection and self-reflection. Even something that we may have done, 5-10 years ago, we really need to stop and think, is that really what's best? Or am I just kind of stuck doing the same thing? How can I do better moving forward? We should always be kind of thinking about that process for ourselves.
Absolutely. Now, tongue tie is a very complex topic, right? There is a lot that goes into that, and it can, of course, feel very overwhelming for the parents, right? And when they seek care, they often come, they're desperate. Their infant is not feeding, breastfeeding is not going right. They see, the infant often is in distress, or the older child as well, if it's an older child where, tongue tie is suspected. So as healthcare providers, I find it's like always our duty to really do a really good job to educate and inform the parents, about what is going on. So what is your strategy? What do you do to ensure that you, have good information for
Yeah.
your families and support them in a way that help them make informed decisions?
Oh, absolutely. There's two answers I have to that. One is just continuing to get educated myself, right? Participating in conferences like this, hearing from others, really learning. Um, there is a tool I like, and I did not invent this. There's an acronym in medicine called the BRAIN tool. And I think for both clinicians and patients alike, we can use this tool to help with clinical decision making. And what this tool, the layout is BRAIN, right? B stands for understanding the benefits, right, of the clinical decision we're making. R, what are the risks, right?
Mhm.
A, what, if any, are the alternatives to this care? I, what is our intuition around this decision making process? And then N, what happens if we do nothing, or what is the next step? So when we're thinking about tongue tie care, one of the tools I'll be sharing in the presentation is how to use our brains, right? The benefits, risks, alternatives, intuition, and doing nothing or next steps. And I think it's a good tool, not just for tongue tie, but many aspects of clinical decision making. And I'm hoping that clinicians can use it for themselves and the patients they work with.
Wonderful. Thank you so much for sharing that here with us, this wonderful tool here as well. You mentioned it's an emotional tongue tie, it's an emotional roller coaster for the families, right?
Absolutely.
How can we help them, deal with also the emotional aspect of the subject?
Absolutely. I mean, it is never just a tongue, right? There's always a baby and a caregiver attached to that baby. So we need to be really cognizant about how they're feeling through this. We do that by being educators, right? We are letting them know, what are we seeing? What are we finding? We're hearing their goals. What are their goals for their baby, their feeding experience? And how can we help give them options that line up with their goals? We are taking our own bias out of the mix. I always let families know I have no agenda what happens to your baby. I really just want to support your goals and help be a sounding board for your decision making process. So, we keep our bias out of the care we give. We hear their goals, which might be different than what our personal goals would be. And then we help educate them to know what are our community resources, and what are next steps and options. And for the emotional piece, I do think anyone working with families in the perinatal period, we all should be screening and identifying when there are emotional and perinatal mood concerns at play as they factor into this whole umbrella and process of care, and identifying who is maybe at greater risk and that might need more support for us to kind of hone in on. So it's a lot to consider when we're talking about tongue tie. It's not just a tongue.
A lot to consider, and I love
Yeah,
how you put it there. Of course, it's not just a baby, it's not just a tongue. It's there's a lot more going on, right? And to really look at the holistic picture, and really also maybe also look at the mental health aspect as well. So,
absolutely.
thank you so much for that. Now, Melissa, before I let you go,
Mhm.
any final wise words for our audience on what you hope they will be taking away from your presentation?
Absolutely. And one of my main take homes is I really want to present a balanced approach to what can be a somewhat controversial topic, right? We've had a lot of emerging data and evidence, particularly, I mean, the last 20 years, but particularly the last decade. And how do we sift through it and make sense of it? I think that the bottom line is we all love babies. We want the best care for them. So I really hope to present the evidence as it stands, help people become critical thinkers around this topic, maybe add some new tools to their toolbox when it comes to assessment and helping families make decisions, and to sort of take some of the mystery out of what can be sort of a conflicted topic for some people when they're thinking through all the elements of care that go into it. So I hope that it's just a well-rounded discussion. We're going to have some interaction and some discussion points throughout the presentation. So I hope people will chime in and let their own voices be heard as we discuss this topic.
Fantastic. Yeah. And I know you have some fantastic videos as well, and case study and so much more. So I can't wait for your presentation. Thank you so much, Melissa, for
It's a
being
pleasure.
here today and, letting me host this little session here and seeing you then at the conference.
Thank you, Kristen. I look forward to it.
And now some information for our viewers. This fantastic presentation here by Melissa Cole is the keynote presentation for our conference here. And you will find out more information. Go to goldtonguetie.com. There you'll find information about the keynote titled A Mindful Approach to Infant Tongue Tie, as well as all the other presentations in the conference. And this particular keynote, Melissa will be presenting the keynote twice on September 9th. So she will be live twice, but of course the presentation is also recorded, so you can also watch it at a time that's convenient for you. So make sure you reserve your free seat at goldtonguetie.com, and don't forget to share it with friends and colleagues in the field as well. Thank you everyone for watching, and have a lovely rest of your day wherever you are in the world. Bye-bye, everyone.